Women today have their own choice. They make their own choices. They are more determined to do things on their own, and they have so many dreams that they want to fulfill. They have to protect themselves to allow them to have a future wherein they have their own biological child.
Happy International Women's Month! I'm Dr. Jing and welcome to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our experts. Today, we shine a spotlight on women's health and the choices that empower us, particularly in the area of fertility preservation and assisted reproduction. Joining us for this discussion is Dr. Debbie Meguizo.
Hi, I'm Dr. Debbie Meguizo, a reproductive medicine specialist who specializes in vitro fertilization. I'm the head for the Center of Advanced Reproductive Medicine and Infertility, CARMI, here in St. Luke's Medical Center, Global City.
Hi, Dr. Debbie. Thank you so much for joining us.
Yes, good afternoon.
So, Doc, I will get straight to the point. We have a lot of questions from our audience. The first one would be yung fertility preservation assisted reproduction. How long has this been going on in St. Luke's, and what can you say about it for our audience?
In vitro fertilization is not something new here. It has been here for a long time. Here in the country, it has already been here for almost a decade. So it has started 2000, but here in St. Luke's, it's almost 14 years. This is the 15th year for the Center of Advanced Reproductive Medicine and Infertility, that's CARMI, which is the only center, IVF center, which is within the hospital.
So because IVF and assisted reproduction has increasingly been talked about,
yes.
And when you see it in Reddit and in fora, we see patients or people talking about wanting to try it, or even they're thinking of doing it for their future.
Actually, you have noted for the past decade, you see that women are choosing the career. They're more focused with their career, and they're very determined to be successful in whatever they do. But unlike men, the problem here is the egg quality is very sensitive to age. So to have a biological child, it would be best that they're aware of the possibility of an egg freezing, especially when they're younger. So it's recommended around late 20s to early 30s to have their egg frozen.
Maybe we can explain to the audience, Doc, what IVF means and what is the difference between that and
egg freezing. So the difference here, it's basically the same. No? IVF and egg freezing, it's almost the same. We start them with stimulating their eggs. So we give medications, either orally or injections. These are ovulatory medications, so we can retrieve more eggs. So these medications are given, and then we monitor them regularly by ultrasound and hormone assays. And once we have a group of follicles which are mature, we give them a trigger shot. Then 2 days after, we get the eggs. So that's what we call ovum pickup. Okay, so when we do your ovum pickup, here in CARMI, we're very concerned with the comfort of our patient. So we give a little sedation to this patient so they won't feel anything. They may feel a little bloated because of the number of follicles that got bigger within their ovaries, but basically that's it. Then when we do the ovum pickup, we retrieve the eggs. This will then be kept in the lab. So if it's just for egg freezing, these eggs are vitrified or frozen. But if it's for in vitro fertilization, these eggs then are fertilized. So we have the sperm available, fertilize the eggs, then we keep it in the incubator. We culture this day 3, day 5, and then once the embryos are okay, we have the option of transferring it that same cycle, or we freeze it. So it will then depend on your IVF specialist as to the patient if the embryo is for transfer or to keep it for a while.
Doc, are there any misconceptions about IVF or egg freezing?
Most of our patients are concerned that they may have menopause early if they do in vitro fertilization. What their thoughts are is if you're going to stimulate more follicles or you retrieve more eggs, these eggs becomes depleted and they go into menopause early. But that's not true. That's not true, because what you're trying to get are the eggs which is available during that cycle. You don't get eggs which is from the other cycle. So if these eggs are not retrieved at that time, it will just die out. Second misconception is that IVF is only for older women, but as you can see, it would be best to freeze your eggs at a younger age. Yes. Third is IVF is not 100% guarantee for you to get pregnant. There is a percentage of pregnancy rate for IVF. So it's around 40 to 60%, wherein CARMI is actually at par with international standards in terms of the pregnancy rate and live birth rate. Another misconception would probably be that when you go with IVF, you'll have twins. But the recommendation is actually just transferring single embryo because this lowers the risk for the mom as well as for the baby.
Who are the ideal candidates for egg freezing, aside from what you said earlier, na age, no?
Yes.
Are
So there are some indications of people who are really have to go through egg freezing. The first one is most of our patients come in for social freezing, or for those patients. When you talk about social freezing, these are women who wants to have their eggs frozen because they have something else. They have plans in the near future yet, or they haven't found someone yet at this time. So that's social freezing. Second, there is the fertility preservation. So when you talk about fertility preservation, these are young women who were diagnosed recently with cancer. So they have to undergo chemo or radiotherapy, which could have some problem. It can cause some problem with your egg reserve. So before any chemo or radiotherapy, we do egg freezing for this patient. For patients who have cystectomy, or those who have an operation in their ovaries, their egg reserve is also limited. So we also offer egg freezing for this patient.
Doc, what are the benefits of egg freezing?
Several women today have their own choice. They make their own choices. They are more determined to do things on their own, and they have so many dreams that they want to fulfill. But eventually you have to think, they have to protect themselves to allow them to have a future wherein they have their own biological child. And the only way to do this is, if they have plans of doing this for a long time, would be to have their eggs frozen at a very early age. Don't wait too long because the quality of these eggs deteriorates as you get older. So we should not settle for less. We don't settle for anyone. We don't settle for anything less. But you have to settle for the best. And the best will mean to freeze your eggs early.
Doc, what are the advances of IVF technology that makes it more successful now for our patients?
There have been several medications that we have been using. It's available now. And these medications actually lower the risks of any problems with in vitro fertilization, especially for cases of ovarian hyperstimulation. So this improves the chances of in vitro fertilization, or the success rate of in vitro fertilization. Secondly, we have many innovations available which allows us to choose the best quality embryo. We have the time-lapse videography with AI, wherein when we have the embryos fertilized, we place it in an incubator and it can check how the embryo grow, and then eventually we can choose the best embryo for the patient. Second, we have options also to choose the best sperm. So we have what we call the MAX, which is an advanced way to check for the sperm, or to choose the best sperm. We also have PICSI, what is the physiologic ICSI. We use it to choose also the best sperm. Then we also have the lens hook sperm selector. We also have microtese. So for patients who have no sperm at all, we can use microtest to microscopically choose the best sperm in the testicular area, which is available in our country, which is available in St. Luke's, as we have microscope available in their OR. For couples who wish to get pregnant, the first thing that you're choosing would be, one, you have to look at the success rate of the center. So CARMI is at par with international standards in terms of the success rate of in vitro fertilization. Secondly, you want to be sure that you have a reliable center. The fact that CARMI is within the JCIA St. Luke's complex, you can be assured of the safety, as well as if there's any problem that may happen, emergency care would be promptly given to you. That's one. Another would be, you have to look into the Now, aside from the security, the safety, you have to look into the transparency and the compassion that the center is giving to our patients. Plus, if you're going to look at the different subspecialty that's concerned, in Carmi, we have everything here within the hospital, within reach. So we have the best IVF specialist in the country or even at par with other countries. We have everything. We can offer everything here in our center. So it's going to be, if you're going to choose a center, you have to choose a center that you trust. And I believe that Carmi should be a good center because it's within the hospital. How much more can you be secure? But it has to be within, when you're within a center where it's highly accredited. As a woman, you have to always remember you don't settle for less. You always have to think what's best for you and you protect your future for a possibility for you to have a biological child. So do egg freezing early and you have that option.
Thank you so much, Dr. Meguizo, for joining us today. I know you're very busy. Thank you for enlightening our audience.
Thank you, Jing, and it's my pleasure. And it's my pleasure to make IVF and egg freezing to be understood by all women and make sure you do it early.
We hope today's discussion has given you a clearer understanding of both egg freezing and IVF and how these options are helping redefine what family planning can look like in today's world. Our sincere thanks to Dr. Debbie Meguizo, Head of the Center for Advanced Reproductive Medicine and Infertility, or CARMI, for generously sharing her expertise and helping us navigate these important topics with clarity and compassion. I'm your host, Dr. Jing Zamora, and we look forward to seeing you in our next episode where informed conversations empower better choices and healthier future.